locking them up, doing this, doing that. We got to find something new. And then the Swiss said, well, let's open up a park behind the train station. They can all go do their thing there, right? And for a year or so, that worked pretty well. Because the injecting drug users got off the streets, the public health services, everybody was there. Even the researchers loved it. It was like easy access that everybody needed to talk to. And then what happened was the foreign drug dealers started coming in and started getting violent and dirty. So they shut down what had become known as Needle Park, but they didn't give up. They didn't go back to the drug war way, the lock them up way. They said, let's try some other harm reduction approaches. Let's set up clinics where those people who've been addicted to heroin for a long time, and they've tried methadone, they've tried drug-free, they've been to jail, maybe they've got HIV or Hep C. Let's allow them to just come to the clinic, and in this clinic, they can get heroin, pharmaceutical heroin, for free in some clinics. It was $5 or $10 a day someplace else. And they'll get baseline methadone, and they'll get health services, and they'll get assistance with counseling and trying to get a more stable housing and work situation going. Because as many of you know, you've been addicted to heroin a long time. You're not really getting that high anymore. You're just trying to keep from getting sick. But for these people who wanted to sort of get their lives together but could not imagine a life without their lady love heroin, they said, come on in. Well, the Swiss did this first on an experimental basis in some of the cities. Then they basically, the public got brought into it, the public adopted it, then the national parliament did that, it became national law. And then the Dutch said, we're going to try it too, with a slightly different research model. And then the Germans said, we're going to try the same thing with a different research model. And then the English, who had been doing it on a small level for a long time, said, let's us do it in a real serious way. And then the Canadians said, let's try this in a serious way. And each one with a different sort of model, trying to experiment, and in every case, finding the same thing. That for the heroin addicts who came into these programs, you know what happened? Not only did they stop using street heroin for obvious reasons, they started withdrawing from the drug scene. They started reducing their other illicit drug use. Right? What else? Their lives started to stabilize. Some of them managed to get some part-time jobs. Some of them, began to reunite with their families. HIV and Hep C and overdose fatality risks went down dramatically. Arrest records, criminality also dropped substantially. They did a fiscal analysis. And they found that these heroin maintenance pilots, which were expensive to run because of some silly security requirements imposed to them, were more than paid for by the reduction in emergency room and criminal justice costs of dealing with people addicted to heroin through that system. Right? And then the Danes in Denmark looked at it, and they said, well, we should do a research study too. And other people said, wait a second, why? Are Danes so fundamentally different than the Swiss and the Germans and the Dutch and the Canadians that we need another research study here? That we need to spend more money on the other? No, quite frankly, the evidence is in. Let's just go do it. In fact, some of them even said, how can we actually construct a research study now? How can we actually construct a controlled double-blind study where one group, where you know that the group getting the legal heroin is going to do better and have fewer disease transmissions and fewer deaths than is the group that's not getting the heroin, the control group. And they just went ahead and just changed the national policy. Now, what's interesting to me, that here's a policy that works hands down. And also interesting is that many people went to these programs, here, all their life. Adult life. They've been chasing that white powder, that heroin. And now, here it is. You want it? You can have as much as you want 3 times a day. Can't take it home, but you can get it here. People came in, wow, great! And after a few weeks, he says, I don't think I like taking as much as I used to. And then they started asking, so why exactly am I coming here? And then they started thinking, what am I doing? And I'm spending my life for this powder here. And you think about it. All their lives, as we do in America, you think, you're a junkie. The only way you're going to get clean is when you got that hammer of the criminal justice system to knock you over the head with, make you be good. We'll give you the option of drug treatment, but if you can't get clean eventually, I'm sorry, but we do have to put you in jail because the law is the law is the law, and addiction to that substance is just simply not acceptable. Well, here's a system where they say, come get it. Here it is. At that point, people, for the first chance, had time to kind of look in the mirror and say, what the hell am I doing? And anybody who knows anything about addiction understands if you want to avoid falling into addiction, or you want to pull yourself out, what's the single most important thing oftentimes? It is uncovering, discovering, finding for the first or second or third time your basic inner dignity, your human dignity. And the American model, which relies so much on we got force people to do it, because nobody goes to treatment unless they're being forced to do it. Well, you have evidence in these places showing exactly the opposite. And they're giving people one of the fundamental ethoses of harm reduction. Harm reduction, as you all know now, is not just needle exchange. It's about allowing people to take one step at a time, whether their ultimate objective is abstinence or just managing their drug use or just taking care of their family, whatever it might be, one step at a time. Each step is good and worthwhile. Just treat your fellow human beings decently, but don't condemn me for what I put in my body, right? I mean, that basic idea is the one that helps people get to a better place. What Portugal did, what Nuno was talking about, was not the Swiss model. They weren't providing the heroin like those other countries did. They were just saying, we're not going to put you in jail for drug use or possession. If you're really a bad guy, you're really doing other crime, we'll get you. We'll get you, we'll lock you up for stealing or other sort of stuff, or even for selling drugs. But we are not going to put you in jail or give you a criminal record simply because you persist in using drugs. We're going to try to persuade you, dissuade you, right, from using drugs. We're going to try to get you to go to, not to a treatment program, we're going to get you to go to a hospital, a healthcare program, or maybe they send you to treatment. We're going to try to help you deal with your issues. We are going to make treatment attractive so that people, when they have that moment, what was it said this morning? The moments of opportunity when you're struggling with addiction, whether it's cigarettes or heroin or booze or marijuana or cocaine, that we can snatch those and work with those things. Now that's the challenge. That's the challenge in the United States. We are now paradoxically leading the world when it comes to experimenting and instituting and supporting and politically effecting sensible marijuana policies. And all of us around the country are looking to you in Colorado, as much as in Washington, to come up with models and make this a responsible, sensible model that people can have faith in. And so that nervous American suburban parents who don't like weed and don't want their kids smoking can look at Colorado and say, you know what? I think what they're doing makes more sense than what my state is doing. Right? So we're looking to you for that leadership there. But we have these other problems in this country. We have this continuing lead the world in incarceration rates at 5 to 10 times the rates of other countries, and the highest incarceration rate in the history of democratic societies. Right? We have this extraordinary racial disproportionality when it comes to the criminal justice system, especially the drug war, whether it's marijuana arrests or whether it's cocaine or heroin, whatever it might be. We have other things that we have to change. You know, we need to set as a national objective that America's rates of incarceration should be where the global average is. Cutting our incarceration rate by about 75%. And there's no reason we can't do that and maintain that safety. But the other piece of this, and this is going to be the real struggle, and since I know so many of you are coming from a public health and harm reduction background, a treatment background here, we have to get to that place where we can embrace the ideal that no matter what your drug of choice or drug of addiction is, we are not going to put you in jail. We are not going to do that. We are not going to take away your freedom, and we're not even going to take away your job, so long as you are doing what you need to do as a citizen and an employee and whatever it might be. We are not going to punish you simply for what you put into your body. We are only going to hold you accountable for the harms that you may do to others and the obligations you may have to family and community and colleagues and all of that. That's the thing we have to aim for. Right? When I look at the drug treatment in the last 30 years, you talk about the crutch that people develop, right? But the drug treatment, too much of the drug treatment world has developed a crutch on the criminal justice system. Too many drug treatment programs have begun to evaluate themselves not in terms of whether or not they are satisfying the patient or the client the way any other area of medical or healthcare would, but on whether or not they're complying with what the judge or the probation officer wants. And that's not right. That's not the criteria of success in dealing with this fundamentally a health issue. Right? Now, let's put it this way. If your crime is that you went out and you mugged somebody, you committed a robbery, then you do deserve to be punished. And if a judge in his wisdom says better to send you to a treatment or rehabilitation or restitution program, fine, that's good. But nobody should be part of the criminal justice system simply because of what they put in their body, whether it's for recreation or for medical or because you're seriously addicted to that stuff. That's going to be the challenge in America. When you look at who was arrested last year, 1.5 million Americans arrested on drug charges, half of them for marijuana, and almost all of those for possession. But another 25 to 30% are for simple drug possession. And that's what's oftentimes filling the prisons. So where do we need to go? I'm going to tell you a drug policy reform I think what it amounts to over the next generation. First, marijuana, take it out of the criminal justice system.
Yes!
And figure out the responsibility for the model. Secondly, end the criminalization of drug possession and be truly committed to treating addiction as a health issue. And thirdly, and I'll see if you go with this, for those, because I don't think we're ever going to legalize heroin and cocaine the way we do alcohol or cigarettes, or not in a very long time. For those people who are so determined to get that drug, that cocaine, methamphetamine, or heroin, that they're going to get it from the black market or the white market, the illegal market or the legal market, whatever it's going to be, and they're going to pay what they're going to pay. For those people who are that determined to get it, offer them the opportunities of treatment and different types of treatment. Offer them the opportunities for other sorts of assistance. But if they really want to get it, then our obligation as a society and as a government is to figure out the way where those people can get the drug they want or need from a legal, regulated source. Right? With almost all drugs, the large majority of the drugs are consumed by a minority of the consumers, whether it's alcohol or cocaine or marijuana. The best way to take the profits out of the hands of the violent gangsters in Mexico and the US and the rest of the world will offer the treatment, offer the education, try to prevent the drug addiction, but for the heavy committed users, if you can't get them out of that, compete with the black market by allowing that legal source. And that's the discussion we need to start having. And when Drug Czar Kilorkowski's out there saying, well, we support, Obama administration supports a public health policy right now, I say, you know something? I mean, yes, you're doing some good stuff on naloxone and overdose prevention. Thank you for finally stepping up on that. And you are talking, you're beginning to embrace it and try to call out more and more of our drug policy reform rhetoric. But you're not really doing a public health policy when you can't even talk about the innovations in Europe around safe injection sites or heroin maintenance or allowing people to get methadone from a pharmacy rather than some segregated clinic. You can't really talk about a public health policy when you keep defending the continued criminalization of drug use or possession. That is not a public health policy. So thank you for using our rhetoric, Mr. Drug Czar, but we want the reality. So that's what we're fighting for. We're building a movement. We're wondering which state's going to be first. Colorado's led the way on marijuana. Can Colorado lead the way on reducing incarceration in America? Can Colorado lead the way on ending the criminalization of drug possession? Can Colorado lead the way on the wholesale transition from a criminal justice-driven policy to a public health-driven policy? That's what I want to know, because I gave the same speech like this, more or less, in New Mexico 2 days ago. I'll be in Vermont another day, and in Washington another day, in New York, and I want to know which state's going to care. We're entering the era of pragmatism, when we say we can no longer afford the idiocy and the cost waste of the war on drugs. That's the challenge for Colorado. I don't expect that to happen tomorrow, next week, or next year, but it's about having that vision of a drug policy grounded in science, compassion, health, and human rights. That vision of drug policy in which the role of criminal justice and criminalization is minimized to the maximum extent consistent with protecting public safety and health. That's where we need to be headed, and I hope you in Colorado will lead the way. Thank you very much.
Woo!
Thank you very much, and I hope to see every single one of you at the Biennial International Drug Policy Reform Conference, October 23 to 26, which for the first time ever is going to be in Denver, Colorado.
We're going to take a 10-minute break.